Okay, so we'll talk about lithium, and what I've put down here in bold are the side effects that really are the more common causes for people dropping out of treatment. 50% of people are going to gain weight, and sometimes a lot of weight, okay? And if you look back at data that predates the availability of these medications, it was found that the rates of obesity in bipolar patients is about 3 times the rate in the general population, even before there were any medications. And so we have a group that tends to have a lot of weight problems to begin with, and 2/3 of these drugs cause a lot of weight gain. Obviously, that's very problematic. It doesn't happen with everybody, though, okay? Sedation, cognitive blunting. Now, this is a very big deal here. Where I've really noticed this are real high-functioning people, and the impact on cognitive functioning has a lot to do with creativity. Let me see if I can describe this. Creativity is a cognitive function, but it's got an affective charge to it. So if somebody's thinking of it, it could be maybe an idea for advertising company, or putting together in the entertainment industry, people that write music or screenplays, scientists who think about new twists to how they approach a research project. Creativity is getting an idea, but it's like, hey, wait a minute, that may just work. Let's give that a shot. It's got this kind of enthusiasm piece to it, and that appears to be what just gets kind of zoned out, numbed out. And people will say, yeah, thank God I'm not having manic episodes, and depression, but you know what? I've lost something. And in this respect, these drugs level things out, but you pay a price for it. And so I think for people that are high functioning and they need that part of their personality, it's a terrible price they have to pay. Tremor, doesn't interfere with functioning, but it's embarrassing. Okay, so that's a problem as well. Some people have a lot of trouble concentrating, though. That's the other cognitive problem. So fatigue, though, that's a very big issue with lithium. Okay. Now, lithium can cause hypothyroid. And we talked about thyroid before as it relates to contributing to depression. So you've got to carefully follow people with repeated laboratory tests looking at a host of potential medical conditions, and especially kidney functioning is very important to monitor, thyroid functioning and so forth. There's questions about whether long-term lithium exposure actually may damage the kidney. I think that the data is soft, but what is very clear is if a person develops kidney problems for whatever reason, this could be very disastrous for people taking lithium, because lithium is an element. It's not metabolized. It goes in and comes out exactly the same, okay, because you can't break down an element. But so it's dependent exclusively on the kidney for excretion. And if the kidney loses capacity to adequately excrete certain things, then you can get a buildup of lithium in the bloodstream, and that can be very, very dangerous. This is a little trivia here. People that are first started on lithium, and of course they're given the song and dance story of you've got to take this for the rest of your life. What do you think the average length of continuation on the medicine is after they get out of the hospital? Okay. 65 days. Again, just kind of a reflection of how much people don't like to take that medicine. All right. For treating acute mania, the lithium levels necessary are within this range. I think most people say it typically has to be about 1.0 or thereabouts. You can push the dose higher, but boy, you get above 1.0 and you start getting into lots of side effects. Now, the really good thing about lithium, okay, and you can't say this for the other drugs, is that once a person has the manic episode has resolved, you can often significantly back off on the dose. Now, we talked about with antidepressants, you don't do that with antidepressants. With some of these other bipolar medicines, you don't do that. But with lithium, once they're stabilized, you can back down the dose. So we can tell people with all honesty that, okay, yeah, I get it that you're experiencing a lot of nausea right now and a lot of fatigue, but there's every reason to believe that once the mania has started to subside, that we can back off the dose and you're going to have less of that side effect. Okay, but so these are the lithium levels for treating acute mania, not for relapse prevention. Lithium toxicity. This is one of the most toxic drugs in the pharmacy. A very small overdose will kill you, and there's no antidote for this. Now we're going to talk in a few minutes about lithium being so useful in preventing suicides, but the problem here is between the time that you start the drug and it really starts working, if a person has dysphoric mania or they have depression, they also have a drug that if they take even a small overdose will kill them. So that's where there's a significant window of great risk. The maintenance doses, in general, here they are. You can go a little bit lower with bipolar 2. Bipolar 1 still is a relatively high dose. The maybe is it's a lot of individual variability. But this is just stating the point I did before, that a lot of times you can back off the dose once they're stabilized. Okay, now, trivia question. If you discontinue your lithium, how can you still use your medicine? For God's sakes, don't throw it away, okay? Lithium has antiviral properties. So if you crush up lithium and mix it in warm water and make a little paste, you can put it on warts and it will kill the warts. It's a wart remover because it kills the virus. The other thing, these trivia things are probably the main things you'll remember from this class, okay? The other thing is that people that are on long-term lithium treatment never develop anal warts. All right, sign me up. Because of the antiviral.